Hi, this is Samantha Bubeck, and my chosen research topic is the impact of nutrient deficiencies in individuals with substance abuse. I believe this is a very important topic that needs to be discussed for a plethora of reasons. But to name a few, this is an underserved population, and I think a lot of that has to do with the stigma um, behind drug and alcohol dependence and the resulting substance abuse from that dependence. This is also a population with a proven need for nutrition intervention, so it's a great opportunity to cover the topic and hopefully be able to help and serve those who need our help. I also believe that nutrition needs to be highlighted as a recovery tool whenever working with these individuals. So those are just a few reasons why I chose my topic. All right, a bit of an overview of the content I'll be discussing throughout this presentation. First, I will be defining the problem of substance abuse itself and kind of further explaining what that entails. I will discuss my purpose statement and the aim of my research. After that, we will be covering commonly abused substances and discussing a bit more about the classification of those substances. I will go on to discuss the methodology that I used whenever I was carrying out and conducting my research and the process that included. I will also discuss the inclusion and exclusion criteria that was considered when I was choosing what studies to be involved in my research. There is also a flow chart I included to better depict how I included and excluded some of the studies. I will be discussing what the studies I did include covered and some of the methods that they used. Then I will be discussing my data extraction, going on to have the results, which we will be discussing. So we'll have results and discussion. And I also found that there are both strengths and limitations to this research. So we'll be covering both of those. And then we'll just wrap it all up with some concluding statements. All right, so defining the problem of substance abuse. It can be defined as overindulgence in or dependence on an addictive substance, especially alcohol or drugs. Um, so, drug and alcohol dependence has been linked to resulting chronic illnesses. So, it makes it pertinent to our field as nutrition professionals. And some of these illnesses include lung and or heart diseases, strokes, mental health disorders and conditions, as well as different forms of cancer. And some examples of how this might happen. Tobacco smoke has been linked to cancer. Methamphetamine is linked to dental issues, which has been kind of nicknamed meth mouth. And inhalants have been linked to damage of the nerve cells and destroying nerve cells. Also, this lifestyle could lead to contracting infectious diseases just through unsafe practices that are carried out. And these include HIV, hepatitis C, infection of the heart valves, also called endocarditis, and skin infection, also called cellulitis. And to answer the question of why this is a nutrition issue, it is because the substance abuse that is happening leads to nutrient deficiencies, which we will discuss a bit more in the following slides. And those nutrient deficiencies eventually lead to chronic illnesses. And there is also weight loss associated with many of the illicit drugs that we will be discussing today. So it is in our realm of discussing. Okay, so I just want to familiarize ourselves with the topic a bit more. So I wanted to cover commonly abused substances and their classes. So the classification that has an acronym of GPCR. Those include opioids and cannabinoids. Opioids that would encompass heroin, fentanyl, um, prescription prescription pain medications, which some of the common prescription pain medications that are commonly abused would be oxycodone, hydrocodone, codeine, morphine, and then there are many others that are often used when I guess those are unavailable or not preferred. Um, then the cannabinoids, that encompasses cannabis and hemp. And then we have the drugs that interact with isotropic transceptors or isotropic receptors or ion channels. And that includes nicotine, alcohol, and then a class of drugs called benzodiazepines. If you are not familiar with benzodiazepines, they are a class of psychoactive drugs. They are a depressant and often described for anxiety, insomnia, and for seizures. And that is a controlled substance. And then there are also the drugs that target monoamine transporters, and those include cocaine, amphetamines, and MDMA. MDMA can also be called ecstasy. It stands for methylene. I said it earlier. Methylene dioxymethamphetamine, possibly. But anyway, that's what it is. All right, so substance abuse impacts our general health, and so it's important that we consider that. And it's not just a nutrition issue. It's not just a substance abuse, drug or alcohol issue. It is a general health issue. First and foremost, weight loss, whether that is involuntary, which is typically the case with a lot of these illicit drugs mentioned, or whether it is motivational. And to describe that a bit more, motivational weight loss in terms of illicit drug use refers to weight control motivation for use of illicit stimulant use. So basically, the use of illegal stimulant drugs to motivate weight loss. Illicit stimulant use was associated with severe weight control behaviors in the study by Bruning in 2018. The nutrient deficiencies that can be a result of this substance abuse is part of the general health that we are concerned about. So that is something to keep in mind. Folate deficiency has been linked to alcoholism. Alcoholism also has been linked to an increase in zinc and copper, as well as a decrease in iron levels. So we also want to focus on chronic illnesses that can result from substance abuse and how that affects our general health. All right, the purpose of my research. The aim is to assess the effects of nutrient deficiencies in those suffering from substance abuse in order to determine how nutrition aids in substance abuse recovery. So in short, I want to find the problem. I want to figure out what deficiencies are most prevalent and occurring, and if they are, which they are from my research, and then determine how we can use that information to help those who are experiencing this recover through proper nutrition treatment. All right, the methodology I used. I did not want to include a ton of databases. So I was lucky to find some really good information utilizing EBSCO and Google Scholar alone. So that was great. EBSCO yielded less results typically, rather in comparison to Google Scholar. Though I would have to say that EBSCO had really quality results. Um, so maybe whenever I was searching, I only had 5 results at EBSCO, but I was able to use one of those 5. But maybe Google Scholar had 100,000 results, and I didn't find a single one that worked out. So that was the case, and that was what happened in certain cases when I was doing this research. So quality over quantity sometimes. And the majority of my research came from journals, and they are peer-reviewed articles. There is one website that is peer-reviewed, but aside from that, the other 32 should be journals and peer-reviewed articles. Key terms that I used when trying to determine this data, trying to find some studies that covered my topic. Some of the key terms I used were nutrition and substance abuse recovery. From Google Scholar, it yielded 91,100 results, and EBSCO yielded 5 results. When I typed in drug addiction and nutrition, Google Scholar gave me 478,000 results, and EBSCO gave me 495 results, which I found that to be quite substantial for EBSCO, honestly. So that was great. And I also searched the terms drug abuse and nutrition recovery, yielding 106,000 Google Scholar results and 5 EBSCO results. When typing in substance abuse and nutrition or nutrient deficiency, I was able to receive 27,200 results from Google Scholar, as well as 8 results from EBSCO. And finally, I typed in 3 key terms for the last one, those being drug abuse, wellness, and nutrition. This yielded from Google Scholar 36,600 results and 84 results from EBSCO. And my studies still needed to be narrowed, so that leads me to discuss my inclusion and exclusion criteria. So that's a bit of a typo. It should say written in English, but that was what my inclusion criteria is. I wanted my studies to be written in English, so that there was no confusion whenever I was trying to extract that data. And another piece of criteria I wanted to include, it had to be a topic covering drugs and or alcohol, with a preferred focus on nutrient deficiencies and or recovery methods. And then also, when I originally started my research, I kind of assumed that I would only be covering human studies, but I found a study that covered cocaine use in rodents, and I thought it was quite interesting, and I thought it really supported my research. So I decided that I would include both human and or animal studies in my research. And then what I wanted to exclude, at first I had no idea what I wanted to exclude. And then once I started doing my research, I knew what was getting in my way. So I wanted to exclude any studies that focused on food addiction. Typing in addiction rather than abuse into a search engine, and having the word nutrition along with it, you get so many food addiction studies, and that was not what I was looking for. I really wanted to focus on substance abuse, not food addiction, and so that was excluded. And then also, like I mentioned, studies that were written in languages other than English throughout. There's no reason to have the confusion. I don't speak another language, so I can't confidently say that I would be able to extract that data well. And then I also excluded any studies that covered exercise addiction, because along with that that food addiction that kept popping up, when you type in nutrition and addiction, you're getting a lot of food and exercise type information, and so that was something that kept getting in my way when I was trying to find quality studies. So okay, so this is just like a little diagram that I created to cover the stages of substance abuse and what it can lead to, what we can do about it along the way. And so we'll start with substance abuse, and if you can try to catch that individual or the group, a population of those individuals while they're in those beginning stages before any problems have began to occur. I suggest a lot of nutrition education um, and getting them involved in being healthy. That you might not be able to necessarily fix the issue of substance abuse, but you can be preventative in making sure that they are eating healthy, and that will hopefully aid in less prevalence of these deficiencies and these chronic illnesses that eventually happen. Which leads me to yeah, the nutrient deficiencies. So if you're abusing the substances for long enough, you will experience nutrient deficiencies unless you're just very lucky. Um, and at that point, we want to suggest supplementation and also healthy eating behaviors, eating patterns. A lot of these individuals are not living healthy lifestyles, so it might be difficult to try to get them into eating healthy patterns um, and to get them into the pattern of taking supplementation. But it's worth a shot. And once these deficiencies progress, especially without that supplementation and without those healthy eating patterns and behaviors, chronic illnesses will occur, or they might occur. It's likely. And at that point, we are back to prevention, but more so in preventing from other chronic illnesses co-occurring. And then we're also at that point of treatment through nutrition, and that's just taking you back to just general MNT, where you're treating for those chronic illnesses. But if they're still abusing those substances, it's difficult, because are they going to follow these suggestions and these guidelines? Do they even know what day it is? Do they know what time of day it is? I mean, there are all these like factors at play whenever somebody is not in the right state of mind because of these substances that are being abused. So it's definitely going to be a challenge if you're ever working with these individuals. All right, so that leads me to my flow charts. Whenever I was um, whenever I was trying to find studies related to this topic, I first had search results that identified. So I identified database searches, which yielded a total of 739,497 results, and that was between both EBSCO and Google Scholar. So that's a lot. I obviously did not have time to read all of those, but I tried to find the ones that were most important, and I condensed it. So the criteria I used throughout filtering, we discussed my inclusion and my exclusion criteria, and doing so, I was able to include 33 articles in my research, and I was able to exclude some articles. That number is actually a typo. Um, so I was able to, take out 33 and include those. So 739,497 minus 33. And that's how many I excluded. Um, and the remaining studies that were included in the synthesis of my presentation yielded 16. So all 33 were really great studies that I found important to my research, but for the presentation alone, I found that 16 were the most ideal and most suiting and fitting for this, this form of presentation. All right, so some of the forms of research and study methods that were conducted in my chosen studies were they included blood serum levels that were tested. A lot of those included included those blood serum levels. A, Quite a few included detailed history and physical examination. And then the remaining were reviews and compilations of other studies. So it was a bit more summarizing and having those narrative reviews of previous studies. But I found the most interesting information in those that included the blood serum levels that were tested, because it really was concrete evidence that these nutrient deficiencies are legitimate, and it shows that these are numbers that we can change. That these are things that we can try to alter through through the supplementation and through this nutrition education and the recovery process. All right, so for data extraction, I use the databases EBSCO and Google Scholar, which I previously mentioned quite a few times. The primary studies that were included. So 16 of the 33 studies were primary studies, and then the other 17 were secondary studies, which I was pretty happy about, because I thought it'd be difficult finding so many primary studies, but once you know what you're looking for, you just know what you're looking for. So, okay, so the results, and let's discuss my results. What I found was that clinical signs of nutrient deficiency were diagnosed in 74% of drug addicts. The BMI, biochemical values, and nutrient deficiency signs indicated that more than 60% of drug addicts were suffering from malnutrition. So we're about at three quarters diagnosed with nutrient deficiency. That is very significant. And then the other 60, or not the other, but and then 60% with malnutrition. This is something that we should be focusing on. And this is why I say that this is an underserved population. We don't let other populations get to this point, in my opinion. But that's a bit more opinion based. So we'll steer back on track. And then nutrition education and nutrient supplementation are vital tools in substance abuse recovery. So that was what I found. Nutrition education and nutrient supplementation, they play key roles actually in substance abuse recovery, and because they help in aiding by reversing the effects of nutrient deficiency and trying to reverse the effects of that malnutrition before they lead to chronic illnesses. All right, so the strengths and the limitations. I believe every study has its own strengths and its own limitations. There's no perfect research. There's just not. So mine had some good strengths, and I was happy about that. The strengths are the nutrition education and positive outcomes with substance abuse programs are evident. We have found positive associations with these nutrition education programs. And findings support the position that nutrition education is an essential component of substance abuse treatment outcomes. Dietitians should promote and encourage the inclusion and education into substance abuse treatment programs. So basically what we're saying is that as dietitians, it's our duty to support these programs and encourage our patients to be a part of those programs so that they can be at optimal health. And addiction and appetite share interacting brain and behavior processes. And I found that to be important. because during the recovery process, hopefully rather than thinking about those substances that are being taken out of the equation, they can focus on the foods that can be added to the equation, and through proper nutrition education, they will know what foods are healthy options to incorporate rather than just having that urge and grabbing anything, everything, without any kind of control or any kind of education or understanding of what it is that they're supplementing there. There were definitely some limitations to my research. So, with no special nutrition assessment or guidance for drug and alcohol dependent individuals, we cannot exactly um, determine specific diets for these individuals as a whole, for this population, I guess. We can individualize care, and that's mostly by determining where these nutrient deficiencies lie and which ones are more pertinent to which individuals, and then tackling that through supplementation, nutrition education, and application of proper nutrition. But so yeah, so there's just no set diet, is what I guess I'm saying for those with substance abuse. But that's okay, and that's fine. I would have to say that most nutrition care is individualized anyway. So this isn't too much of too much of a turn into a different direction. And then it's a huge limitation that some individuals are not ready for recovery. We have to realize that these individuals are dependent on these substances, these drugs, and these alcohols. So it's going to be very difficult to pull them away from something that they believe that they need, um, because their body has become dependent on it, as well as their brain. They Even if maybe they're not physically dependent on it yet, there's a good chance that they're mentally dependent on it, and so that's something that limits the effectiveness of trying to implement nutrition as a recovery tool and method. Okay, so let's wrap it up. All right, so this all of this data, all of this research, it is important to many people in the medical field, but I would have to narrow it down to three, and that would be the dietitians, because of the role nutrition plays, and I think it's important that a dietitian be part of these situations, because they have the most education and experience to to be able to look at these labs and to be able to say, well, this is what's going on. This is what it could lead to, in terms of chronic illness. These are my nutrition suggestions. It's also very important to medical doctors. Their primary should know what's going on. Any surgeons that are involved because of medication interactions with these drugs. Basically, just any medical doctor on their staff needs to know if the individual has a substance abuse problem, and this information can be very important to them in understanding, helping them recover. And then also the psychiatric staff, that's very important because many of these substance abuse problems, so addiction and um, these drug dependencies, they are often associated with psychiatric issues, so mental health issues. Like I said, that's actually one of the chronic illnesses that can become of these substance abuse problems. So it's important that the psychiatric staff, if one is involved, know about these problems, and that they know about this research, and that they can broaden their knowledge through this research. Implications of the study. The study concluded positive outcomes of nutrition application in substance abuse recovery. So that's great. That just means that um, we can keep including nutrition education and application in in helping these people get back to optimal health. Um, and also, there's always more research out there that is needed, and in this case, it's needed before guidelines for substance abuse recovery can be determined. As I mentioned, there is no set diet for for this population. It's very individualized. So that's just one of the implications of the research is that more research needs to be done if we want to determine a set diet. And to go back a bit on that team of the dietitians, medical doctors, psychiatric staff, nurses, I mean, everyone that's involved. This is a group of professionals, and they can benefit both individually as well as interdisciplinary by from they can benefit from this research as individuals in their practice as well as working together in their practice. So I guess that's all I was saying. And I want to thank you for watching my presentation. Hopefully you found it as interesting as I did and important to address because I find this to be such an important topic to address that, as I said before, is not addressed enough. So thank you very much, and I hope you enjoyed.